सलीम साहब, आई विल आस्क यू वन क्वेश्चन। आपसे एक चीज क्वेश्चन पूछता हूँ, क्योंकि आपने अभी वैक्सीन लिया है, ठीक है ना?
जी, मैंने वैक्सीन दिया है।
हाँ, तो ये बताइए कि वैक्सीन लेकर कितने दिन हो गए आपको?
एक 1 वीक हुआ है।
1 वीक हुआ है। तो लेने के बाद आपको कुछ सिम्टम, कुछ हेडेक, कुछ चेंजेस फील हुए क्या? What I'm trying to ask you, whenever any virus change their behavior, that time it is a more dangerous. So this vaccine, which temperature required to store?
It's a very fragile vaccine, so it needs to be stored minus 70 degrees, so it needs to be frozen.
Today we are going to talk with London. Two doctors with me, is Dr. Asad and Dr. Bushra Yusuf. And we are going to talk about the coronavirus disease, what increasing in UK, what is the reason behind that. Dr. Bushra, thank you so much joining Indian Media Book, or Dr. Asad, thank you so much. Doctor, I want to give you a little bit brief about your country. If you see the month of March, it was near about 2,425 death case was there. And the month of April, it has gone very high, 26,000. And after that, May, near about 37,000. But after that, June, July, August and September, it was only 4,000 death case. The people was very relaxed. But if you see after that, what happened, October 4,000 case, November 10,000 case, and December 11,000 plus cases. So what do you think? What went wrong with this death rate and new disease, the people are getting sick, the number increase? What is the problem?
Put in place, be it social distancing, lockdown measures to try and control the spread of the virus. And naturally, as you would expect, that would reduce the number of cases. As that's relaxed, and invariably it would need to be relaxed in due course, you'd see an increase as well. And again, I think it was always there was always an awareness that over winter months, that's often when you do see an increase in a lot of other viruses, be it the influenza, among other things, that you would again naturally see an increase in the course of the prevalence of the virus. So I think there is that kind of that observation that we've seen, and with this sort of lockdowns and measures put in place, that would to an extent control the spread. And as that was lifted and certain people returned to work and schools would reopen and shops and so on, that we've seen that there's been a spread there as well. So that's been a situation that's been monitored throughout. And obviously there have been other sort of changes as well that have occurred during that time, including with this new variant that has been detected recently. So I think in answer to your question, I mean, you mentioned what had gone wrong. I mean, I think the first thing is an observation of what's the natural behaviour of viruses generally that you'd see within a community, and the measures that were taken in place to stop it. And I think from that point of view, certainly early on, you'd see what was expected in terms of the control of the reduction numbers, and then it would sort of increase as things opened up again.
So now tell me one thing, that this new mutant, if you see that, and how dangerous this new virus?
So, and again, I mean, with about the coronavirus generally, I mean, it is, as we said before, it's a novel coronavirus, so it's something that was seen new. And initially, the behaviour of the virus, the transmissibility, the complications, how ill people would get, who was vulnerable, all this is being analysed. It continues to be studied, and we learn from it. In terms of what we know so far, and the information obviously again is coming out and constantly being looked at, but it appears that the new variant that was detected is more transmissible, meaning it can be spread more easily than the previous variants. As for the effects of it, is it more dangerous? Do people fall more seriously ill with it? Then so far, the evidence doesn't seem to suggest that. But again, I mean, that's just from what we have so far, and it's an ongoing evaluation and assessment of that.
Okay, so do you think the same vaccine will work for this type of changes is happening? Any research on that?
So there's a number of vaccines that have been developed, and probably the most well known is the Pfizer-BioNTech vaccine, which gained approval, and that vaccine program has already started in the UK. And again, I mean, this is something that is ongoing, and the research is looking at this. But so far, the thinking is that the vaccine should protect against this new variant as well. I don't know if you want to add anything to this.
No, that's right. So far, all the evidence suggests that the BioNTech and the Oxford vaccine will still be effective against the new variant, but it's early days, and this needs more study.
So which company vaccine is started in UK right now?
So in the UK, the Pfizer-BioNTech vaccine has had approval from the MHRA, which is a regulatory body in the United Kingdom that looks at or approves medicines and carries on researching and looking at the effects of it. So the Pfizer-BioNTech vaccine is the one that has been approved. The Oxford vaccine is obviously one that has been is still currently under a review in the UK, and I believe the information has been submitted to the MHRA, so we're waiting the results of that.
So in this vaccine, it is only one dose. How many doses, and if it is dosed, how many days gap required from one dose to another dose?
So with the Pfizer-BioNTech vaccine, there are 2 doses, and the 2 doses should be at least 21 days apart. So after the first dose, the research shows it's 57% effective, but after 2 doses, a week after the 2 doses, it's 95% effective.
Okay, so
it's
after
very important.
giving the dose, the patient feel any kind of tiredness, any symptom you see that?
It's common, so it's been reported at least 27% have common side effects associated with most vaccines, and that would be soreness of the arm and mild flu-like symptoms like headache, mild fever. This usually occurs within 48 hours of having the vaccine and usually lasts less than 24 hours.
Now tell me the new cases, what is coming in UK, a number of cases. So because of the new mutant, that viruses change their behavior, because of that, in how you find out it is a new symptom and old symptom, do you people have any research on that?
So this is something that that will be sort of looked at. I don't think I have. I mean, certainly personally, we don't have any more information that's been published or conveyed already. As I mentioned earlier, the information so far suggests that although it's more transmissible, meaning that it can spread more easily, the actual symptoms aren't more serious. It hasn't resulted in more hospitalizations. So that's the current understanding and information we have. But again, that will be looked at and is still being looked at as we learn more.
Okay. So if you see the nowadays people are not taking that much precaution, people not wearing very frequently masks, distance are not maintained. So do you think that fear in the society is not there, it is required, or it can be like ignored? What do you think? What do you suggest as a doctor?
I mean, obviously, it can't be ignored, and as we've seen an increase in cases, I'm not sure I'd necessarily say that the public is being more lax. We've seen that although there were plans made in the UK to relax the rules over the Christmas period, that was actually then reversed and following announcement by the UK government, those relaxing of those restrictions was actually then pulled back. So I think people are very aware that that social distancing measures, hand washing, these sort of simple measures are important, and where possible, things like being able to work from home, not going out unnecessarily, is still important. So and again, with this announcement, or with this knowledge of a new variant coming out, which people will be aware of as well, I think that is understood. So I think it is understood. I think people are still taking those measures. It's normal that a kind of certain fatigue does get experienced by people when they have been having to behave differently over a long space of time. But I think generally, from my own experience, what I've seen, I see people are still taking the appropriate measures, and that don't know if that's what you would agree with as well.
Yeah, I mean,
your practice.
I would urge people to continue taking those measures because we know that they definitely are very effective and very simple. So I think it's something we have to be mindful. Although many people may get symptoms and they may have mild disease, we have to be mindful of the vulnerable in our community. People may pass it on while not exhibiting symptoms themselves, but then pass it on to someone who's very vulnerable and make them very seriously ill. So simple measures like hand washing, wearing face masks, keeping socially distant, they're simple things that we can do and they're highly effective. So we would urge people to do that.
Okay, tell me the last 2 months, month of like November and December, whatever cases you are getting in UK, the age group is different or whatever happened in past is the same type of symptom. Means age group that time is different or this time the age group is different.
I mean, in our sort of practice, obviously, we only, where our work is more in the community and not hospital based. I guess what we see is going to be different. But there's two aspects to this. One is the people who are testing positive for infection, and the other group of people who are getting more seriously ill. So within that group of people who are getting infected. So again, some of the information seems to be that the spread, certainly over the recent time, was with a younger age group, maybe more with school-aged children, and in certain areas of the UK that was maybe driving the rise in cases. How that was translating to people getting unwell, I don't think that the evidence so far suggested that it was the same age group. I think it's still looking at the vulnerable, the elderly, who are still at risk, but it's just who was passing on the infection and coming back positive infection, it is perhaps changing. So, I mean, to answer your question, I don't think we've seen, certainly in our practice, a major change in terms of those people who are getting unwell with the new variant, but I think there's been some evidence in terms of where and who the infection is passing within.
What I'm trying to ask you, whenever any virus change their behavior, that time it is a more dangerous.
So, and again, it goes back. I mean, there's a couple of things. Coronaviruses generally, I mean, coronavirus is a group of viruses which we've known about for a long time. I mean, the COVID-19 is a specific one, which I'm sure people are aware of. But with regards to coronavirus in general, they tend to be quite stable. They tend not to mutate so much. In terms of how things more long term, what we expect to be the outcome of this, as I mentioned, I mean, it's so far the evidence doesn't suggest that people are getting more unwell with it. So, I mean, it might spread a bit more easily, but that doesn't necessarily mean that people are getting more unwell with it. And certainly evidence so far doesn't seem to suggest that. And sometimes bear in mind, if there's a shorter, if something is transmitted quicker or a shorter space of time, then in a way it can be easier to control or be aware of who's unwell. Sometimes it's a bit harder when you have this longer phase of transmission where someone could have it for a certain amount of time, 2 weeks, and spread it and not be aware of it, as opposed to other illnesses where it's a lot shorter, and so it's a bit more predictable. So I think going forwards, I'm not sure necessarily much has changed apart from still taking the precautionary measures to prevent the spread. In terms of the end results, in terms of how sick people are getting, so far there doesn't seem to be a sort of a worsening of the illness or more severe symptoms based on the new variant, so far as we're aware.
Okay, then tell me one thing and last key. After the number of cases increase on UK and number of death increase in UK, how the citizen of UK is behaving now? They are more scared or they are going for the normal work? And what will be suggestion for the public now?
Okay, so as I mentioned, I mean, there were plans to try and relax some of the rules over 5 days over Christmas, and that was then pulled back. In the UK, where they previously, after the most recent lockdown, had a 3-tier system, they introduced a 4th tier, which is more strict in terms of the restrictions that people are under. And I think going forward, and we're looking, I mean, that gets reviewed every 2 weeks or so, looking at the numbers and the patterns of infections and illness that we see. I think going forward, I mean, we'll probably find, and the hope is that that will control to an extent how the virus is being spread, and then it allows people to get back to work in a safe way. I think with the current spread that we're seeing, one of the questions being raised is, does there need to be a lockdown of schools? There wasn't, and I think the government was very keen to not shut down schools for obvious reasons, because children do lose out and do suffer by not getting back to school, and there are limitations to online learning, which a lot of what some children were undertaking and ideally undertaking from previous lockdowns. So I think perhaps the sort of most one of the big things coming up now is how children return to school, and there is talk of maybe delaying that or having online lessons in the first instance to try and control the spread. So I think these are all measures that will need to take place. We're still at the time where, I mean, bear in mind in the UK in January, February, generally speaking, we see a lot of viral illnesses. Usually it's a peak season for things like the influenza virus, which fortunately we're seeing less of because people are socially distancing. So I think we still have that period to go through. And even though the vaccine is being rolled out, I mean, you're looking at the next few months being very key in terms of seeing how things do develop.
सलीम साहब, आई विल आस्क यू वन क्वेश्चन. आपसे एक चीज क्वेश्चन पूछता हूं, क्योंकि आपने अभी वैक्सीन लिया है, ठीक है ना?
जी, मैंने वैक्सीन दिया है.
हाँ, तो ये बताइए कि वैक्सीन लेकर कितने दिन हो गए आपको?
एक 1 वीक हुआ है.
1 वीक हुआ है. तो लेने के बाद आपको कुछ सिम्टम, कुछ हेडेक, कुछ चेंजेस फील हुए क्या?
नहीं, कुछ नहीं हुआ.
Everything was normal, जैसे था वैसे.
Anything apart from a little bit pain in my right shoulder about an hour. That's all.
Oh, that's all. Okay. So now, already I spoke to Yusuf Saab, and he is telling about after taking the first dose, he has little bit pain. That's all. So it's very, very light, mild. So people are not supposed to get scared. What do you say, doctor?
Yeah, I mean, as we mentioned, with any kind of vaccination, you can get some soreness in the arm, and you can get some minor symptoms. So I don't think that's particularly different from many other vaccinations that we've seen. And you know, here in the UK, they've administered, I think, over 600,000 doses of the Pfizer-BioNTech vaccine. And from that number, I mean, they will, I'm sure, publish any sort of problems, and part of the functions of the MHRA, the UK regulatory body, is not just to approve a vaccine, but it's also to monitor its ongoing use and any side effects that are reported. So there's a process in place to be able to do that. So when you have such high numbers of people having the vaccine or any kind of medication or intervention, you do gain a lot of information from there, and hopefully a lot of reassurance that so many people, especially the most vulnerable people, so the elderly people, have had it and have been well with it.
So tell me, the vaccine is easily available for everybody, or shortage is there, or it will take, how much time it will take to all the UK citizens take the vaccine?
Yeah, it's a good question. I mean, I think here in the UK they have a program to prioritise who gets the vaccines first. So you have vulnerable groups based on being care home residents, their age, other illnesses, NHS, health sector workers, and so on. And at the moment, I mean, the vaccine, although available, there isn't enough to be able to vaccinate everyone in one go. So it's a rolling, ongoing process. I guess the hope is that there are some other vaccines like the Oxford vaccine also on the horizon. And once that's approved, and that one is probably a bit easier to store, or it is easier to store, then that may then accelerate how quickly this can be rolled out to the population. So it's not going to be a quick process getting it out to everyone, which is why, in answer to your previous question, I mentioned it's still very important to make sure those measures to prevent spread are still being adhered to, and people are still being responsible and careful in terms of their own personal behaviours.
Okay, this vaccine, what citizens of UK is getting, it is free of cost, and any charges involved on that?
That's right, yeah. So the vaccine program, like a lot of the vaccine programs in the UK, is through the NHS, so that it's not charged to the patients individually. And that's much like, for example, the flu vaccination, which is given to vulnerable groups, or the childhood vaccinations, part of the UK program as well. So yes, it is free in the UK.
Okay, a lot of citizens and the rumors are there in the market. This vaccine has a lot of side effect, and that's why. What do you think? If people are coming easily to take vaccine, or people are scared?
I mean, I think there's always going to be a degree of apprehension, especially where, I mean, the vaccine, and more credit to the companies that have produced it, the people who have worked on it, and the organisation that have approved it. They've done it at really breakneck speed, very quickly, because of the urgency of the situation. So it's gone through very quickly. At the same time, I think that speed sometimes does raise concerns among the general public, like with any new medication or vaccination or procedure. And as I mentioned, there are robust processes in place, whether it's here in the UK, which I'm familiar with, the MHRA. I mean, there are obviously other organisations like the FDA in the United States, which have approved the vaccine, and also in Europe and other places. But as I mentioned, I'm more familiar with what's the processes here in the UK, and I think people should have that confidence in that procedure, both in terms of the approval of the vaccine, but also the ongoing monitoring. The fact that, as I mentioned, in the UK, over 600,000 people, I think, now have had the vaccine, and that's still an ongoing process that's being looked at and monitored. And I think if there were very significant numbers of side effects or problems, then in that large cohort of people that have already seen the vaccine, you would expect to find numbers within that, or more significant numbers within the people who've been vaccinated.
So this vaccine, which temperature required to store?
Yeah, so I'll let you want to speak about that one. I think.
It's a very fragile vaccine, so it needs to be stored minus 70 degrees, so it needs to be frozen. But while we are delivering the vaccine program, the vaccine needs to be stored in a normal fridge and we have 5 days in which we need to use up the vaccine. It's very different to a normal flu vaccination program. So we will be delivered in boxes of 975, and we will need to use up all the vaccine within 5 days. Usually we get very short notice in which we're going to get the delivery, so we have to book 975 patients within a very short space of time. And we have found actually the uptake has been very good. So we are working on the over 80s at the moment, and they have been coming along to receive the vaccine. So so far there has been very little wastage, so no wastage as far as I'm aware. We have also managed to vaccinate our frontline NHS staff as well. So I mean, dealing with the vaccine, it has its challenges, but it's doable. We've made it work.
Yeah, I mean, that's.
Sorry, yeah, please.
I was going to say that's the Pfizer-BioNTech one specifically, which has got approval. There are a few other vaccines, for example, like the Oxford one, that don't need to be stored at such low temperatures, and therefore, when that gains approval, which it looks to be the case, and there's the Moderna one from America and a few other ones as well on the horizon, that the storage requirements aren't as low as the sort of ultra low temperatures which the Pfizer-BioNTech need to be stored at. So that will mean with the new vaccine, which the UK has ordered a certain number of the different vaccines already, it will probably be easier to administer those.
So, doctor, any idea how many people are taken till now vaccine in your country?
Yeah, so with this Pfizer-BioNTech one, the numbers, as far as I'm aware of, is just over about 600,000 people have received it.
How many days, like when you started giving the first vaccine?
And the first vaccine, so they, I don't think anyone would have had the 2 vaccines yet, because it's only been the last sort of week or two. So I think the last week or 2 weeks. I think.
The program started second week of December, as far as I'm aware, where we started in the hospitals and in general practice.
So main thing, we can see the difference within 15 days that the vaccine is working or not working, right?
I don't think you can say the vaccine's working or not working in those first 15 days, because it is 2 doses. So they wouldn't have completed the vaccination. They would still need to have that second dose 3 weeks after the first one. So I think, even based on how the medication should be administered, we wouldn't say that they will be effective and that will suddenly change things over that space of time. So we'll only really know after people have had the second dose and a space of period of time has passed beyond that. What we can say is that certainly looking at some of the side effects or problems that you might expect both immediately after the vaccine and for a certain space afterwards, we've had that number of people receive a dose. So up to this point, and these are people, this is even, obviously the number of people on a trial basis and before the approval process or during the approval process, these are people who have had it since it's been approved. And we know that over this space of time, you've had a very large number of people receive that vaccine. And so you've got all that information in terms of whether they have suffered any problems, both immediately after the vaccine and for this space of time afterwards. Yeah.
So thank you so much, Doctor, joining and giving the brief.
No, thank you. Thank you for having us on.
Thank you so much. Thank you. Thank you.